Okay, since I was muted earlier, Chona Adventure, thank you for joining in. Confirm that you can hear me. Hello, hello, hello. Can you hear now? Hope this light is not too bright. I think it's better. Can you hear me now? My audible. Thank you for the feedback. Where are you joining from? Where are you joining this live from? Chona. Chona Adventure Vlog. Okay. Marianne Mogu Travel Vlog. Yes. Marianne is doing a lot on travels. He's really into traveling. Yes, I remember. I remember now. Thank you, Chona. Thank you for joining my live. Where are you joining from? Where is your location? I'm streaming live from Nigeria. Where are you joining from? So I remember very well that we met on Marianne's live and got connected there. So how are you today? Are there things that you're doing to keep yourself healthy and to stay fit, even as we move towards the end of this year, 2024, and then as we move into 2025? Chana, why no moderator? Trying to understand the question. Okay, we started this particular session about 4 minutes, less than 5 minutes ago. We had an earlier session where we had moderators, close to 2 hours of interaction on the live. But now that you are forced to join in, so welcome. You can serve as a moderator, Chona. What's the C? Why no moderator? What's the C? Is Sona or Chona? What's the C? You can see you type the C there. What's that, please? Okay, Chona, this seems to be the first time you're joining my live, right? Okay, Chana, I understand what you're saying now. So I understand what you're saying. You can see Rajesh is already on blue because it's been frequent, should I say frequent? A very frequent, loyal member of this community. Rajesh, welcome back. Okay, so Chona, it seems this is the first time you're joining my live. Welcome. You're welcome. Chana, if you don't mind, let's know where you're joining from. Rajesh is live in India. Rajesh is live in India. So Rajesh says, back again. Yes, back again. So we had a break after close to 2 hours of interaction. And I was just going over the points I made earlier on common health problems in Nigeria. And we had to take a break uh, at that time. So this is like a continuation of that session, and I'm glad to have you all here joining this live. Rajesh, how is work? Are you at work now or home? Yeah, thank you for the like, Rajesh or Chona. Thank you. Back again. We are back again. Welcome, everyone. Okay. Okay, Chana, I can see your message now. You say, I do live stream every day. If I check the link of my visitors, I give it moderator, even if is or have new in my live session. Okay, Chana, a lot of things happen on social media, and as much as possible, there are guidelines and different measures that we put in place, as we connect with one another. Okay, so Chana, there's no problem having you as a moderator. Okay, well done, Chana. So Chana, what do you talk about? What do you talk about in your live stream? What do you talk about? What do you do on your live? Chana is saying bye. Bye. Why bye? Is that all for now? Chana, is it because there's no blue jacket yet? Why living now? Chana adventure. So we need to find ways to connect well with one another. Chana is doing a lot, and we can connect with her, but since she's going off at this time, So let's know where you're joining us from on this live. So channel, hope we catch up again later. Chona, 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 chona. Chona is in the Philippines. So Chona does a lot on life, on travels also. Okay, so if you are here, this is like a continuation of our earlier session on common health problems in Nigeria. Right now, I'll quickly do a recap of some of the health problems mentioned earlier. I mentioned malaria being top on the list, infectious diseases, malnutrition, non-communicable diseases like hypertension, diabetes, and cancers, respiratory infections like pneumonia, bronchitis, and influenza. These are common health problems in Nigeria. However, we still have more. And before we go to the next one, it's important to note the role of vaccination, as I was mentioning that earlier, the role of vaccination in preventing some of these disease conditions, like the program on immunization that includes the BCG vaccination, and then there is the pneumococcal vaccine available, and these are vaccines that can help to prevent individuals from having these infections. Now, I was talking about the need for ventilation, as ventilation will help in air exchange such that unlike crowded places, the well ventilated areas will allow for the germs, organisms that are released from individuals who cough are not limited to the environment. So, other individuals who may actually get infected are prevented from getting this infection. So, good ventilation will go a long way. Other things include the use of medications. Some people benefit from oral medications, others may benefit from injections, and this treatment is not limited to taking drugs. There are other supportive management that individuals will benefit from, like the treatment of fever, and the treatment for low blood levels. They need to take note of all these different different effects that come when an individual has an infection. Okay, so the next common health problem of Nigerians is related to water, and there are waterborne diseases, and these include cholera, include typhoid fever, includes dysentery. Okay, so this may be caused by contaminated water sources, people coming in contact or actually ingesting this type of water or food prepared with this type of water. So poor sanitation is another cause, and inadequate hygiene practices. So the way to prevent getting any of these waterborne diseases is first of all individualized, and then at the family level, community level, and national level. So personal hygiene is important, and education on how to take care of individual's environment keeps going on in the public space, on the social media, and then through various platforms, people get education. And now, because there are hygienic practices, and then access to clean water is very essential. Clean water is essential for people to ensure water has that cleansing effect. So water for cleaning, apart from bathing, water is essential for cleaning surfaces, and it helps a lot in the prevention of spread of certain infections. So it is important to note that waterborne diseases are common. So hygiene, proper good hygiene is very important. So if you have symptoms like nausea, vomiting, abdominal pains, and it may not even be you, it may have someone around you, uh, may even be passage of something that looks like rice water stool, and somebody passing bloody stool, may even be one or more persons, and these are uh, symptoms that should call for attention. They're actually symptoms that require an individual to present for proper medical assessment. Okay, so you should note this as part of management of people with these waterborne diseases. Next, my note here is maternal and child health issues. There are quite a number of issues that have to do with women, and women especially, during, even before, during, and after pregnancy. There are also issues related with children. So there is high maternal mortality, and this may be related to reduction in skill or inadequate skills available, especially in the rural areas, and then the brain drain that is ongoing, the movements of people from the region, in fact, from the nation, talking about the Japa syndrome, and people moving, trained professionals, people moving, not just the health sector, definitely, but a lot of people are professionals in the health sector that are moving, migrating from Nigeria to other countries, and so this leaves a gap, and then makes it challenging for people to access professional care. Now, so there are challenges with maternal mortality. So mothers or pregnant women are not able to access proper antenatal care, which is essential for a safe delivery. Okay, so because good antenatal care can help to prevent complications that can arise at delivery. Okay, so it is during antenatal care that some health conditions are identified, and then proper ways to live as a woman, pregnant woman, will be communicated. So that's very is lacking now. So poor antenatal care is one of the challenges with maternal and child health problems. There is also the risk of neonatal infections because of those practices that actually occur in the local regions. For example, some believe that after delivery of baby, the umbilical stump should be treated using cow dung or some form of concoction, and this puts the baby at risk of infections. So, education is critical. It's very important to preventing this kind of situation. And then there's also the risk of preterm delivery, uh, because when there's poor antenatal care or no antenatal care, this is also a risk factor. And birth asphyxia, that's where a baby is not able to initiate or sustain breathing after birth. This can, as it has its sequelae, which may include cerebral palsy, and these are some of the complications that arise from poor management during the reproductive age, and then during antenatal, expected antenatal period, and then delivery of baby. So, what should be done to reduce maternal and child health issues in Nigeria? Things like education, that's is for emphasis, the need for regular and widespread information on the things to do when a woman is pregnant, things to do towards delivery, and things to do after delivery, how to manage a baby, how to take care of a baby. These are some of the things that are important. And this is not just for the doctor, it's also for other healthcare workers. We have nurses, we have health attendants, we have people who can serve in different rural areas that can help to pass this message across. And there could be provision of leaflets, and where for people that can actually read, they may even be in different languages where people can easily relate with and see the need, encourage people to see the need to seek professional care. And there should also be some more interactions between professionals, like doctors, and people who work more in the rural settings, who relate more like maternity homes, like some religious settings where people actually go to deliver. So where there is proper education and training on how to manage such people, there will be little or no gap in the care that they receive. So improved maternal health care services, there should be some level of improvement in maternal health care in terms of funding, making structures available, and giving support individuals, families, communities, the nation at large, governments, non-governmental organizations supporting women, and especially women in pregnancy and women after delivery, and supporting their children. Family planning is also important. This can help to limit the complications that arise during pregnancy and delivery. That's that on maternal and child health problems. Next, common health problem in Nigeria. Common health problems in Nigeria. Before we move on, I want to say welcome again. Thank you, Sebuna TV. Says welcome back, doctor. Thank you. Yes, I had to attend to someone, and I had to take a break at that point. So we were on the different categories, points on health problems in Nigeria. So I've done a recap, just trying to get to a conclusion on other common health problems. Okay. So thank you for joining me again, Sebuna. So what are the common health problems that you know that I've not mentioned? I've mentioned malaria, I've mentioned hypertension, diabetes, I've mentioned infections like hepatitis, HIV, and other respiratory infections like uh, the tuberculosis, bronchitis, and then we've talked about maternal and child health. Now, mental health disorders, that's the next on my list. And these mental health disorders include depression, anxiety, and substance abuse. These are common in Nigeria. Now, there's a lot of stress ongoing, financial stress, environmental, workplace stress, school stress. People are going through a lot of stress, but there are ways by which people can cope and handle stress. However, when stress becomes prolonged, it could lead to burnout, such that the individual becomes less productive, individual may become ill, and this will now take some time to manage. However, um, no matter the reason and the cause of depression, anxiety, this can be managed. Now, some of these issues also have social stigma associated with them. Okay, so that's why right now we don't even want to use the word mental problem or psychiatric problem and all. Want to use terms like behavioral medicine. Of course, mental health may still be used, but that word, when people hear psychiatry, then they're thinking um, to a large extent, in a way, about somebody is maybe someone is mad or something like that. Okay, but that's not the case. Usually, some people may even be depressed, and they are not. They are yet to be identified as being depressed, and a lot of people suffer from anxiety, and they are not able to handle this. So it's important to make campaigns for awareness. People need to be more aware of these issues happening in the country, and then there should be family support, community-based support, and policies to help people to do better in their mental health. Now, when it comes to policies like allowing for breaks between work, allowing for times for relaxation, allowing for time for interactions, medical checkups, and all this will help. Counselors being made available for people to be able to assess when they have challenges that they need to discuss. Okay, so these are very important things, and part of the management will include not just seeing a mental health professional, talking about a behavioral medicine expert. Other members of the team include a clinical psychologist, uh, like they are also apart from clinical psychology, behavioral, occupational therapists. Different form of therapy can be given to people to help them get back in shape. Okay, so this is very important. Next on the list is sickle cell disease. It's a common problem, and this is associated with a genetic blood disorder. It's common among Nigerians, and the impact of this include pain. Have you ever seen a sickle cell anemic patient in pain? I mean, you don't want to see them in pain. Sometimes the pain could be so severe that they need to get admitted, and sometimes for days. So pain crisis, low blood levels, anemia, and even some organ damage. They could even suffer from a stroke. So it's important to note this. Of course, it's just the chance of having a sickle cell from the combination of one S and another S or SC. Now, that's where genetic counseling comes in. In fact, apart from getting to that level, there's a need to have pre, that's where the pre, is it precoce, premarital counseling should come in, where people even go for medical checkups to know their genotype, such that they can, as much as possible, take decisions that will be helpful for the children, children that should come, and then to also take proper treatment where some conditions are identified. So it's important to do counseling in taking decisions in marriage, and then neonatal screening can also be done, and then supportive care for those who have been diagnosed with this condition. And then finally, on common health problems in Nigeria for this session, there are also road traffic accidents. Road traffic accidents. These are common and commonly related to uh, bad driving. We call it reckless driving by people who are on the wheels, and people. Some people don't even have a license to drive. Some do, and they still drive recklessly. And some don't have proper training on how to drive on the road, relating with other drivers, relating with other people who use the road. Now, these are the causes of road traffic accidents. Poor road infrastructure is also a factor. Reckless driving, I mentioned that. Lack of enforcement of traffic laws, which is something that is changing as the government is committed to helping the populace, helping its people to live without disability and live longer. Now, the impact of road traffic accidents include high disability rates, also includes high mortality. Okay, so improved road safety measures need to be put in place to prevent road traffic accidents. Measures, different measures, education, and then strict measures for fines for people who disobey traffic laws. I think we're gonna have it there, concluding the session on the common health problems of people in Nigeria. Okay, do you know someone who has or is presently having a challenge with any of these medical conditions? Then you can be of support with some of the information you have from this session. Thank you for joining in. If you have any question or any comment, remember you can drop in the chat box, and I should respond as soon as I see your question. Any question, any comments, observations on common health problems in Nigeria? Okay, if there are no questions, then we will be closing on this in less than 5 minutes. Okay. So thank you for joining in. I see some people coming in, going out, coming in, going out. Sorry. Okay, so you can watch the first part of this session, and then you can also watch the second part as soon as it's made public, the live session. Yes, in the live section, you can watch it there. So see you. Bye for now. Bye bye.